Something I wish someone told me when I was an intern is that it doesn't matter how well your procedure goes most of the time, so long as the patient doesn't hate you afterwards and the nurse taking care of that patient doesn't hate you afterwards, regardless if you're successful or not. And I feel like most residents that do procedures have been there, right? Like they do a central line or an IV or a chest tube or a lumbar puncture or whatever, and they crush it on their first go. And then they forget to clean up afterwards. The guardrail on the bed is still down. You left a mess. So the nurse is not a huge fan of you after that, rightfully so. That's not their job to clean up after you. And when I have medical students that I'm teaching, I tell them that that's really the most important thing, because part of consenting someone for a procedure is the procedure might fail and it might necessitate further procedures, right? If you do a central line and it's the X% where you go too far on the IJ and they get a pneumothorax and now you need to do a needle or a chest tube to get that better, that needs to be part of the consenting process. That's how they can make an informed decision to do a procedure. And I feel like everyone goes through times where procedurally you're doing well, but in the back of your mind, you know that you're due to miss one or to not get it on your first try. But that shouldn't stress you out, because part of the process to consent for these things, you need to let them know that, hey, it might not work. Sometimes people need help. Sometimes it's a second pair of hands. That's a normal thing in medicine. It doesn't always go well the first time. So that's something I always say out loud when I have trainees in the room when I'm getting a patient ready. I talk like the patient is in the room, because they are. And I make it clear that one of my main goals is, to the patient, to the nurse, to everyone else involved in the room, I want to make sure they're happy with me after the procedure, regardless of how well it goes.